What is health promotion and health behavior? We are the innovators and interventionists. We change population health through multiple levels, from the individual to families, institutions, communities, and globally. We are the social behavioral scientists that identify structures in societies that exacerbate health problems among different groups of people, and we use behavioral theories and strategies to reduce barriers and increase incentives for individual health behavior changes that impact population-level health. As health promotion and health behavior scientists, we work with other disciplines in public health to make public health happen. If you consider biostatistics and epidemiology as the building blocks or foundation of public health, they use quantitative data to identify where a population health problem might exist. Whereas health promotion and health behavior, we take those data and we investigate further why those problems exist and for whom. We also look at what assets and barriers specific groups and communities may have in addressing the public health challenge and develop interventions that ultimately change behaviors that lead to population-level health change. Sometimes we work through supporting other disciplines in other contexts. In the case of environmental occupational health, where they are considered pillars of public health, our theories and methods can move behavior change beyond education toward acceptance, compliance, and training in occupational regulations and safety. We also work with communities affected by environmental injustice to organize and advocate for change. Health promotion and health behavior also scaffolds and supports health policy. We intervene using communication strategies to change the agenda, assist in community organization and advocacy, and encourage support of policy change. Once implemented, we support compliance of policy changes through interventions that aim to increase knowledge, change social norms, attitudes, and beliefs, and identify and address barriers and increase incentives for that behavior change. Health promotion and health behavior is the science of understanding people and building a fully functioning public health enterprise that addresses health and health equity across our entire population. What does this look like in real life? An excellent example of true public health integration and the importance of health promotion and health behavior is tobacco control. The 1964 Surgeon General's Report on Smoking and Health was a landmark publication that helped identify smoking as a public health risk. Research in the 60s and 70s were primarily conducted by epidemiologists, statisticians, and pathologists who focused on the consequences of smoking cigarettes, but not on why people smoke. It wasn't until the 80s and 90s that smoking was recognized as a complex behavior which has reflected deep social, cultural, and economic forces, as well as a powerful biological process of addiction. Simply identifying individual behavior as a primary vehicle of risk negates the fact that behavior itself is, at times, beyond the scope of individual agency. So a complex, integrated, and multi-level approach is needed to combat tobacco's impact on public health. California was one of the first and most progressive in creating comprehensive tobacco control to reduce morbidity and mortality related to tobacco use. Some examples are developing mass media campaigns to alter social norms around the acceptability of cigarette smoking, creation of quit lines and cessation programs that were instituted to help people quit, education and health promotion programs made required for elementary schools to prevent the initiation of smoking among youth, and advocacy for rules and regulations around air quality in occupational and housing settings helped pave the way to reduce the effects of secondhand smoke and reduce the overall prevalence of smoking through the Clean Indoor Air Act. Finally, laws prohibiting the sale of tobacco to minors and restrictions on types of ads tobacco companies could use to sell their product. Health promotion and health behavior is interdisciplinary, and we come from fields from psychology through human development and family sciences, sociology, anthropology, education, behavioral sciences, medicine, and beyond. Using an interdisciplinary approach, we work to identify why people are smoking, and we created strategic approaches at multiple levels to make population-level changes in tobacco-related disease. Health promotion and health behavior integrates and works across disciplines, again to answer why people are getting or remaining sick, and also how can we improve their health. So what does health promotion and health behavior look like for you, and how will we use it in this class? You'll be learning about the role of prevention interventions in population health. You will apply multi-level models to understand the complexity of a health problem and identify potential interventions. You will learn and use social determinants of health to discuss the impact of health and health inequities. And you will learn of methods used to design, implement, and evaluate public health programs. Welcome to the world of health promotion and health behavior.